Okay, well, one of the things to mention about sore nipples is obviously the word sore is a bit of a subjective word. What does that actually mean? What should women be tolerating in terms of discomfort? To be completely honest, for some women, even if breastfeeding is going well and everything's fine in terms of positioning and attachment, for the first few days there is going to be a little bit of mild discomfort. Again, how do we define mild? What we expect, if your nipples are being stretched to 2 to 3 times their natural length and sitting in the right position in the baby's mouth, that's probably going to feel a bit sore as the nipples get used to that sensation. So maybe day 2, day 3, day 4, we're feeling a little bit uncomfortable. We're feeling a bit of tenderness in the first 15 to 20 seconds of a feed as that nipple is stretching. It may be useful to put some cream on, but let's not overestimate the importance of cream. Some of these lanolin type products can be useful to keep the nipple moist so it doesn't dry out and crack, but it isn't going to solve a problem if there's a deeper problem, which I'll talk about in a moment. If you're still getting discomfort throughout a feed, and it's not going in the first 20 seconds or so, that might suggest there's something wrong with your positioning attachment. If when the nipple comes out of the baby's mouth, it looks flattened or squashed, or it has a ridge across it, or it looks like an old lipstick and it's tapered at the end, that's another indication that something's not been quite right about the way the nipple is being placed in the baby's mouth. But if the nipple comes out, it's longer but rounded at the end, if there's no visible damage, if there's no bleeding or cracks, it might just be that soreness is completely normal. Carrying on, the main way to avoid sore nipples is getting the right positioning and attachment. That is the basic answer. So if you're still uncomfortable going into the second week, probably something's not right. So it's time to go to a group and get some support. You can also call the helplines. I know it sounds a bit weird to talk about positioning and attachment on a helpline, but they are trained to talk about that issue over the phone. So do call the National Breastfeeding Helpline or the Association of Breastfeeding Mothers Helpline and someone can help you. So when it comes to positioning attachment, the key thing to avoid sore nipples is getting that big, nice, wide mouthful, that big, nice, wide gape. We want that baby's bottom lip to be as far away from the base of the nipple as we can. There's no good having a little, small, tight mouth. That means the nipple's just not going to get far back enough into the baby's mouth. It's going to be rubbing against the hard palate and causing discomfort. It doesn't matter if the top lip is reasonably close to the top of the nipple itself. We want that bottom lip to be as far away as we can. And we want to make sure the baby's chin is nice and tight to the breast to allow that tongue and jaw to do the right job it needs to on the breast itself. So if you really are uncomfortable and sore, please get help. But it's not unusual to be tender in the first 2 or 3 days.